at what point are we saying
Right.
how could do an amputation? Like, what will need to have happened?
Okay, so when there are situations whereby the leg becomes dangerous to you, when there's an infection that is started in the leg, that is ascending.
It's so bad you can't treat it, doc.
Sometimes in people who are HIV positive, who are diabetic, the elderly, because their immune systems are compromised, they can have these infections. That can start as a minor prick, a subtle prick, and then they get infected, so that the leg is dying and the flesh eating bacteria, so that if you don't amputate, the infection is going to spread through the whole body, and then this person is going to die.
So, doc, if someone, if a patient comes to you and they say, and this is happening, and you recommend an amputation, are they allowed to say no?
Everyone is a right to consent to a procedure. So we cannot operate you if you haven't consented. But it is our duty as the healthcare provider to counsel these people so that they understand the benefits of the amputation. But there are always benefits and risks, so they need to understand the benefits of this procedure. It's unfortunate that because most people, when you offer them the amputation, most people refuse or they take their time. But during that time, this condition is already worsening, and sometimes we operate when it is already too late.
You? In terms of diabetes, for you to say we're going to amputate a limb.
So with diabetes, Simba, your immune system is suppressed, so that any infection that a normal person can get and the immune system is able to fight. If you have diabetes, your body is not able to fight this infection.
Right.
So you can just get a subtle prick, and then the thorn introduces infection to your foot, and then this infection starts to grow. That is why diabetes is a very important topic in this situation. Some cancers as well, you can have cancer of the leg, like melanoma, squamous cell carcinoma. So you have this cancer that is going to spread up, and affect other parts of the body. So we need to amputate so that you beat the cancer before it spreads.
All right, and I'm going to ask, as someone says that you have to chop, amputate their leg.
You wanted to say chop their leg, didn't you? Amputate.
Amputate.
Yes.
Be nice.
Listen, I'm working on it. How soon can you get a prosthetic? Can you immediately after have that put in, or you actually have to do a couple of months and time before you can then get a prosthetic?
Yeah, we cannot put the prosthetic soon after the procedure, because remember, after the procedure you have a wound. You need to recover from the surgery as well, and this wound also needs to recover well enough so that it can hold the prosthetic. So we usually say after at least 6 months. So for 6 months you are not able to use a prosthetic, either you're using crutches or you're using a wheelchair to mobilize, but you become dependent on other people. This is why it's very difficult to agree to amputation, Noxie and Simba, because imagine you've been moving around every day, being independent, and then one day we just say we want to chop your leg, and then you now need people
amputate.
amputate. You now need people to carry you from one place to the other, so you become dependent on people.
Can we talk about the psychological aspect of amputation? I just can't, in my own mind, think about it and say, losing a limb. Just the thought of losing a limb by itself is torturous. It's traumatic.
Yeah.
What is the psychology behind it?
You know, it has huge psychological impacts. Psychological, social impacts as well. That's why most people delay coming to hospital. Because some people actually come to hospital when part of the limb is black. Black, and it's aura.
So how do we see, before you respond to Simba's, I guess because you brought up the leg with how do we then know infection arc? What should we look at? Because right now it's just a whole broad
before you get to the point of we need to amputate.
Yes.
So ideally, when you get an infection, you need to be treated. But most of these people, they come late, and when they come, us as doctors, when we do our clinical assessments, you can tell that there is flesh-eating bacteria. This limb, and then sometimes it comes ratoa black, especially in people who smoke, in people that are older. It just comes ratoa black, and then you have to amputate. But it has huge psychological impact, Simba. That is why most people actually delay coming. That is why people also fail to consent. Sometimes you may consent, but your relatives, especially the older gogos, they may say yes, can you go ahead? But some relatives come, so the brothers from the mom's side, they come and they say, don't touch my sister. I would rather bury my sister with her or
is that a thing?
Them. Yeah, that's
it's
what
a thing. Like, yes, people be like, we want to
So that happens. But
Wow.
it only delays intervention.
Eish. Okay.
Yeah, no. In terms of families and friends and support systems, how important are they for someone in an amputation?
When you're counseling these patients,
Yeah.
you also need to counsel the relatives
Yes.
and the people that they live with, because
Yeah.
they are going to be pivotal in the management and recovery of these patients.
Because life has changed.
Because life has changed. This is
Yeah.
someone who was independent. He's going to need someone to pull them off from a couch
Yeah.
to bed or to the toilet. So you also need to counsel the relatives so that they have a good support system.
Yeah.
There are also some complications that can happen after the procedure. The commonest one is we call it phantom limb pain. It's an exciting complication. You have had
Not for the person who's been amputated, obviously.
Exciting.
for the person who has been amputated.
Tell us.
So your limb has been chopped off, has been amputated, but this is a condition whereby you still feel pain that is coming from the leg or the limb that has been amputated.
So if they've chopped off, if they've amputated
You've been
from
amputated?
the knee down,
Yes,
you
but
still feel pain in your toes.
You still
Wow.
feel pain in your
How?
toe. You feel as if
The brain.
the brain, because we've cut off the nerves that are coming from the brain to the toe. So any irritation on the stump, the brain will feel as if the toe is there. So sometimes they feel like there is a fly that is on my toe, or
But there's no toe.
But there's no toe.
Bro.
So that's the other
And-
psychological impact.
And how long does that take to how long does that take?
It's nasty,
to go
not
away?
sensing, but it might take forever. But we always encourage them that it will definitely get better, because this is now a psychological issue. So sometimes we refer them to psychologists,
Yeah.
so that they counsel them, they deal with them, but it takes a bit long for it to recover fully.
All right. Hey, yeah. This
Yeah.
is hard.
I have a question, but I don't know if it's proper to ask.
Simba, this is a safe space.
Okay, if you have phantom pain,
Yeah.
do you recommend taking a painkiller?
Yeah, sometimes they need to take a painkiller. Sometimes there are some meds that we give them that will help them to sleep better. That will also help with anxiety. Anxiolytic drugs, they make it better because they are feeling pain. They are feeling pain.
It's actually
It's
your
actually pain.
bruh.
But it's
I had
pain
to
that
ask.
but it's pain that is coming from a limb that is no longer there.
And it's just the brain
So
playing
it's the
tricks on
brain
you.
now.
Yeah, so sometimes you need to give them painkillers for them to recover, but it becomes more of a psychological issue rather than a physiological issue.
Yeah. All right.
Doc,
So see a
thank you.
doctor immediately if you are compromised, your immune system is compromised, and you may.
Or your toe starts getting green.
Yeah.
Before that happens, please see your doctor. Anything else, Doc, before we wrap this up?
Amputations can also happen traumatic. Some people come, usually those who work in this industry, they can just have a machine chopping their
Dog.
or chopping their arm. We've had quite a couple, so they come.
Can you sew
that
those
is-
back on?
In most cases, we just have to formalize the amputation, because some come when the whole limb is fallen off, or that whole part of the limb has been chopped off. So you just have to formalize it. It happens in some of these instances.
So we can't put them back together?
It depends on how severe it is. Sometimes the
Okay.
orthopedic surgeons they can bring
Piece it
it back
together.
How many
But
minutes or hours?
Simba.
It depends. It depends on how severe it is. It depends on how severe it is, and you can also have what we call auto amputation. If you have disinfection, if you delay coming to the hospital, sometimes you can come to us when the toe is already fallen off.
I remember that story when they were talking about the GD6. Remember?
You can have auto
The
amputation.
toe just and then.
It wasn't that.
Oh, okay.
They were sacrificing, apparently.
They were coming to us.
They were coming to
And
doc
one of the
and saying,
doctors-
check you.
Unfortunately, the doctors never bought GD6.
The doctor's in.
Alright,
Shout
Doc,
out to
thank
Dr. Mano.
you.
Thank you so much,
Yeah,
Doc.
welcome, guys.
Have a good one.
Was the doctor.